Hi, my name is Megan Jones, and this is my project Early Education on Gestational Diabetes, a DNP project submitted to the faculty of the Catherine Macaulay School of Nursing in partial fulfillment of the requirements for the degree of Doctor of Nursing Practice at Maryville University in 2022. Gestational diabetes is a complication in pregnancy that can lead to numerous other complications. It is a problem that affects pregnant women around the world. Not only is it a problem for the mother, but gestational diabetes can affect the current pregnancy, future pregnancies, and lead to health complications for the baby as well. Early intervention for healthier lifestyle choices have been shown to decrease the rates of gestational diabetes. Gestational diabetes typically goes away after the baby is born, but about half of those with gestational diabetes tend to develop type 2 diabetes later in life. There are also other complications associated with gestational diabetes, such as macrosomia, high blood pressure and preeclampsia, cesarean birth, and preterm birth. These complications can lead to adverse outcomes for mom and baby. With proper screening and education, the mother and baby may avoid negative consequences. The key to decreasing the prevalence of a disease is prevention. The object of this scholarly project was to determine if early education on gestational diabetes, healthy diet, and exercise can decrease the development of gestational diabetes when compared to pregnant women who do not receive the education. Gestational diabetes can be defined as diabetes that is diagnosed in the second or third trimester of pregnancy without a previous diagnosis of diabetes. Educating pregnant women on lifestyle modifications is the key to decreasing the chance of developing gestational diabetes. Risk factors include advanced maternal age, family history of type 2 diabetes, and obesity. Another predictor of gestational diabetes is physical activity level pre-pregnancy and throughout the pregnancy. This was a quantitative practice improvement project using a case control study with convenient sampling. The population consisted of first-time pregnant women between the ages of 18 to 35 who do not have a history of diabetes and are only pregnant with one fetus. Women were recruited for the project by sharing a recruitment flyer to Facebook and with the midwife office of the community person involved with the project. The flyer was shared to different Facebook pages to increase the population it reached. It was shared on the researchers' Facebook page and to different mom and breastfeeding groups to allow the most women to be reached. The women were added to a private Facebook group just for this project once it was determined that they met the inclusion criteria. On the flyer, there was a link to a Qualtrics survey to determine if the women met the inclusion criteria and to provide them with informed consent. They were then divided into two groups, an intervention and control group, by a random numbers table. Once the two groups were created with enough participants, the women in each group received a questionnaire on their knowledge of gestational diabetes. Then the women in the intervention group received an educational PowerPoint regarding information on gestational diabetes, healthy diet, and safe exercise during pregnancy. By educating early in pregnancy, the women would be more likely to make healthy lifestyle choices throughout the remainder of their pregnancy to protect themselves and their baby. After the women in both groups took their oral glucose tolerance tests around the 26 to 28 week mark, they completed the post-intervention Qualtrics survey to retest their knowledge, and then they were able to report their oral glucose tolerance test scores anonymously. The researcher compared the knowledge scores from the gestational diabetes screening forms between the groups. Then the oral glucose tolerance test results between the two groups were compared. The statistician from Maryville used the data collected to run the statistical analysis. The inclusion criteria were a part of the questions on the Qualtrics survey, and it include that the participant must be between 18 and 35 years of age, be less than 20 weeks pregnant, have a singleton pregnancy, and have a care provider for routine prenatal care. This is to ensure the women are of legal consenting age without an increased risk of complications due to advanced maternal age. The women must be receiving routine prenatal care for follow-up from their provider and to ensure all is safe for the mom and baby. The woman must only be pregnant with one fetus due to the increased risk of complications with multiple pregnancies, including an increased risk of gestational diabetes. Recruitment and data collection began in May of 2022 and was completed in July of 2022. The Qualtrics questionnaire consisted of 10 questions that involved demographic information and fulfilled the inclusion and exclusion criteria. The questionnaire was sent out for each woman to complete. This told me if they were eligible to participate in the study or not. At the end of the survey, if they met all criteria, there was a link for them to follow to the private Facebook group. Once in the group, the gestational diabetes related knowledge questionnaire was given out, and it is a 15-question questionnaire. This tool focuses on general knowledge of gestational diabetes, signs and symptoms, management, and adverse outcomes of gestational diabetes. The scores were calculated to see how many questions each woman got correct and were compared to the oral glucose tolerance test results. For the questionnaire, pre- and post-test scores were gathered and compared between the two groups. All data was compiled into an Excel spreadsheet, and all patient identifiers were removed to protect anonymity. The patients excluded were those outside of the specified age range, a woman pregnant with multiple fetuses, a history of diabetes, or not receiving routine prenatal care. The sample size for this scholarly project was 144 women. The number of women who received the educational intervention was 72, and the number of women who did not receive the educational intervention was 72. An evens and odds table was used to determine who would receive the educational intervention and who would not. This table much acts like a random numbers table. A z-test for the difference of two proportions was used to determine the statistical significance of the educational intervention on the prevalence of gestational diabetes. The researcher was 95% confident that the difference in the proportion of the development of gestational diabetes among those who received the educational intervention and those who did not was between negative 0.0284 and 0.2784. The confidence interval suggests there is a true change in ratio from control to post-intervention. However, since 0 is included with the interval, there is no significant evidence to show a change in one direction. The p-value of 0.0567 is greater than the significance level of 0.05. Therefore, there is not sufficient information to suggest the educational intervention decreases the prevalence of gestational diabetes. 52 out of 72 women in the intervention group passed their oral glucose tolerance test with a score of less than 140. 43 out of 72 women who did not receive the education also passed their 1-hour glucose tolerance test. The achieved power of the study was 0.4751, which was considered medium in strength. 27% of women who received the education did not pass their 1-hour glucose tolerance test, as well as 40% of women in the control group. Although these numbers have a large difference, they are not statistically significant. Therefore, the researcher can conclude there was inadequate evidence to suggest that early education will decrease the development of gestational diabetes among pregnant women. These findings are similar to some of the studies that were reviewed in the literature critique. This study implemented education on a healthy diet, exercise, and information about gestational diabetes and its effects on the mother and her child. However, the study found that 27% of women who received the education did not pass their 1-hour glucose tolerance test, as well as 40% of women in the control group. Although these numbers have a large difference, they are not statistically significant. Prior studies have shown diet modifications or exercise play a significant role in decreasing the prevalence of gestational diabetes, but there is little research to support both interventions and their effectiveness at reducing rates. In this quality improvement project, there was a lower percentage of women who failed their 1-hour glucose tolerance test in the education group. However, the data did not have statistical significance. A major strength of this study is having a large sample size of volunteers who participated. Having a large sample size helps to yield more significant results. By the participants volunteering to partake in the study, it decreased the likelihood of dropout throughout the duration. There were no women who dropped out of the study, and the study had a moderately large sample, which helped to contribute to the strength of the study. Gestational diabetes is a problem that is on the rise around the world. By finding a way to educate women that is convenient, educational, and low requirement for participation, women are more likely to participate and benefit from the intervention. Because this intervention took place via social media, women did not have to commit time to go to a doctor's office or follow a schedule. They could do all learning and activities on their own terms. All studies have limitations, which are factors that are out of the researcher's control and can compromise the results. This study had a few limitations that significantly impacted the results. There was a time constraint on data collection. Ideally, the time period for the intervention would have been from the first prenatal visit until the time of the 1-hour glucose tolerance test. Studies have shown that earlier education and lifestyle changes are made, the less likely the woman is to develop gestational diabetes. However, due to the time constraint, the inclusion criteria had to widen to allow women 20 weeks gestation and less to be included, rather than just in their first trimester of pregnancy. Another major limitation comes from the COVID-19 pandemic and not being able to secure an office that would allow for in-person intervention or recruitment. However, because of COVID, telemedicine was vastly increased, allowing for safe, timely, and accessible care. If this researcher was able to utilize in-person appointments for recruitment and randomization, it is likely there would have been more women participating due to easier methods of recruiting. Another limitation is the sample is homogeneous, which can affect the generalizability. This topic is generalizable to pregnant women overall. However, there were strict inclusion and exclusion criteria. The sample consisted of 144 women who were pregnant with their first baby, did not have a history of diabetes, and were only pregnant with one fetus. The ethnic and socioeconomic status were not evaluated for these women. Statistically, women from lower socioeconomic status and non-Caucasian backgrounds have higher rates of developing gestational diabetes. In order to be generalizable to the full pregnant population, a more in-depth look at demographics would be beneficial. Gestational diabetes is a worldwide problem that can have long-standing effects on a woman and her baby, and the prevalence is on the rise. In the United States, the rates of gestational diabetes have increased by 30% in the last 4 years. The results of this DNP quality improvement project indicate a need for further research in the prevention of gestational diabetes. The goal of this study was to decrease the rates of gestational diabetes by providing pregnant women with education on lifestyle modifications and risks of gestational diabetes early in their pregnancy. 27% of the women who received the educational intervention failed their oral glucose tolerance test, with a score of greater than 140, compared to 40% of women in the control group who failed their 1-hour glucose tolerance test. While the study did not have significant data to support education decreasing the development of gestational diabetes, the findings are consistent with other studies that have shown to be statistically significant. A longer implementation period, an in-person setting, and a greater number of participants may have produced statistically significant results. By educating pregnant women early in pregnancy, they can gain the power to take control of their health and make more health-conscious decisions for themselves as well as their baby. This project reinforces the need to educate women early in pregnancy to decrease the incidence of gestational diabetes. More research is needed to evaluate the best method of providing universal education to pregnant women to allow for healthy lifestyle modifications to be made. The results of this study open the door for interventions to be made early in pregnancy to try and tackle the rising problem of gestational diabetes and the complications that can arise. This study has significant clinical implications because it adds to the generations of research that are required to improve the translation of evidence into clinical practice. Thank you for your time, and thank you for giving me the opportunity to be able to complete this DNP project in this program.